Hi, my name is Jacey. I'm one of the registered veterinary technicians here at Galloway Village Veterinary, and today I'm going to be demonstrating how to check your pet's blood sugar and administer insulin at home. So the first things you will need is your glucometer, your lancing device, testing strips, and a cotton ball. So preparing for the blood sugar check. Take the lancing device and take the clear cover off of it. Grab a new lancet and twist the safety cap off. Insert the lancet into the lancing device and replace the clear cover. When you pull back on this, you'll hear the click, and now it is loaded. When you press this button, it will lance the skin and then directly retract back into the device, so there's no risk of poking yourself with the needle. As for prepping the glucometer, you'll grab your meter and your test strips. Take out just one test strip and close the cap, and administer the strip into the device with the butterfly facing up. When you press it in all the way, the machine will power on. When the code pops up and powers on, just make sure it's the appropriate code for the species. We are doing a cat today, so I'm changing the code to match for a cat. And then you'll need your pet. Our house cat Toothless is helping me today. So a few different spots that you can check blood glucose are the edge of the ear. There's a vein that runs right across the edge of the ear. You could also do a paw pad, like the edge of a paw pad, or even sometimes in dogs you could do the inside of their lip, but that one is less preferred. The ear vein is normally the easiest. So when you're performing the blood sugar check, you will take your cotton ball and place it, I know, Toothless. Take your cotton ball and place it on the outside of the ear. So the other side of the ear, you're going to be poking on the inside right there. Prep your lancet device by pulling back. And I'm not actually going to poke her, so I'm going to trigger it now so I don't have a risk of poking her. Put your cotton ball in the back, place your lancet, and then trigger the lancet so that way you get a drop of blood. At this point there should be a drop of blood forming, but if not, you can remove the cotton ball and kind of milk it or squeeze it a little bit to get a little bit more. As long as this is still on, in which it is, and has the blood drop going so it's ready for blood, you would grab the ear, tap the drop of blood with the strip, and you would hear it beep and it would record a number. You want to record that number, the time the blood sugar was taken, and any special activities that your pet was doing, such as you had just fed them, you haven't given insulin yet, you gave insulin 2 hours ago, etc. After you're done, you'll just apply small pressure with the cotton ball and it should stop bleeding in just a few seconds. The ideal times to check your pet's blood sugar are right before food and insulin in pets who are already diabetic, if you're seeing any signs of high or low blood sugar, or as directed by your veterinarian. As for when to administer insulin, you will be given very specific instructions by your veterinarian, but generally it's every 12 hours after eating. If your pet did not finish at least 50% of its meal, alert your veterinarian for further instructions because you would not want to give insulin without them eating. And now we're at the kind of scary part for most pet owners, is how to administer insulin. So generally it is stored in the refrigerator, so I've already plucked this out, and you do not want to shake it. You could just gently roll it in your hands to resuspend the liquid. And then also make sure that your syringes match the type of insulin they're giving. So this insulin is what is called a U100, and my syringe also needs to be U100. If you're picking up syringe for your pet here at the clinic, we will make sure that your pet is getting the correct syringe for the insulin, but if you're purchasing them elsewhere, it is very important that you pay attention to this. So I've rolled the insulin in my hands to resuspend it. Most insulin syringes have this little cap at the end, and you'll just pluck that off. Flip the bottle upside down so that the liquid is at the stopper. Take your cap off. The needle is typically very thin and very short. Insert the needle into the bottle. To get the liquid into the syringe, you will hold on to this outer tube and pull down on what's called the plunger. And that will get insulin into your syringe. And then only pull up and give how much was prescribed. If you're getting any kind of bubbles in there, you can always flick it gently to get those bubbles to the top. The best place to give insulin is generally right over the shoulder blades. What you do is you pick up a small amount of skin called the skin tent, and you will kind of feel an excess space subcutaneously or underneath the skin, right kind of between your fingers. What you will do is grab your syringe with the insulin in it, take the cap off. I'm not with her because she's not diabetic and doesn't need insulin. You'll tent the skin, insert the syringe, and then give the insulin. And that's it. So Toothless would have had to have already eaten at least 50% of her food in order to get that insulin. If at any time you were worried about your diabetic pet and worried that their blood sugar might be too high or too low, or if they're not eating, definitely give us a call here at Galloway and we will point you in the right direction. We know having a pet diagnosed with diabetes can be super scary at first, so if you're needing any further explanation or demonstration, please give us a call and we can get you on the schedule.